do his nose. I'll do his nose while you're getting ready. Dr. Emer, we're live! Hey guys, it's end of the night in Manhattan and we're doing an acne scarring sort of rejuvenation treatment for my younger male here. He looks great already, but he has a couple little acne scars that I marked, and he had a little burn here that caused this scar. You can see it right here. Now, I'm gonna pinch in. When I pinch right now, you guys see the scar doesn't move because we put some filler in there and we subcised the scar. This was a big indentation before, which was like really making him depressed and making him self-conscious. And I don't know, Jordan, can you put that on there or no? The before and the after?
I have a folder. It's not in.
Oh, that's okay. Well, we'll show it in the future. So we did a little Bella fill. That will fill out that area. Right now, we are working to finish our resurfacing because we're going to do our favorite combo, Halo Profractional. That's going to be the laser of choice for him for rejuvenation. It's going to shrink his pores. It's going to make his skin texture look better. It's also going to improve the scarring. And then I'm going to do aggressive scar resurfacing on his bigger scar there on his lower cheek. I want you guys to see if you zoom in or you show them up close what the halo looks like. You can see all these little dots on the skin. All those little dots are holes that have literally been created by the erbium laser that is going to make them heal over the next few days, up to a week, usually about 3 to 5 days. And then it reveal smoother skin. We just saw another patient, Jordan. Tell them about that patient. She was only, what, 3 or 4 days after Halo Profractional?
Yeah, one of our patients who is not a media patient, so we can't show you her.
Unfortunately.
But we just saw her. She's 3 days post Halo Profractional full face, and she looks amazing right now.
Her scars were very deep, and today, as there's peeling, you see underneath the fresh new skin a lot of healthy, beautiful skin. It's much smoother.
What do you recommend for large pores and acne scarring?
This, and my Emerage Skin at-home derma roller with peels like Enlighten or Airify regularly, and just doing these types of treatments. I want to do at least 2 on him, and then we go to a maintenance phase probably at that point. Now we're going to do the cheek area. Turn all the way right. I'm going to lift you and turn. We have a little bit of music in the background because it's nighttime in Central Park. We could show them the nighttime in Central Park. So as the nighttime hits, we get a little delirious because we've been doing halos all day. And so we need to make it a little fun here. So my patient and I together chose Machine Gun Kelly. I think it's a good choice for the end of the night. Thumbs up from our patient. And oh, I didn't even notice until right now that he's wearing Nana Judy, which is my favorite sweatpants. My favorite sweats are Nana Judy and t-shirts. My best friend got me them for Christmas. Well, Hanukkah really, but Christmas all holiday gifts. So now we're doing Halo on the cheek area. He's doing phenomenal with topical numbing as well as nerve blocks. And you guys can see really up close, take a look. The erbium creates all those little holes, all the little channels. And those channels are going to peel. Right when you peel, it's very important for you to use your retinol and hydroquinone, my AOC, and honestly, my Aerify kit was designed to immediately help the skin exfoliate, but also the high spot that's in there has in it peptides, green tea extract, a couple botanicals, and peptides to help you heal. So those providers, and we have a new Michigan provider that's going to be utilizing Aerify, you know how good those results are going to be.
We have people all over the place carrying Aerify at their clinics. We have one of our great providers in Canada, and we have
Puerto Rico.
We have Florida. We have all over the place.
Very excited. How does it feel? Are you okay? globally sort of blend, is what I call it, global blending, after we finish this halo.
Oh, we have the Sciton label going on.
And this is still our go-to sort of acne combination. You know, about a third to half a way through, we got to get rid of those dead skin cells. So you get rid of those dead skin cells and we just keep on going. If you don't do that, the laser can't penetrate as well and you lose on some of the outcomes. So make sure if you're a provider, continuously cleaning. So you guys see super up close. We're getting in there. Now I have these amazing innovative optic goggles on. These are my Jason Emer MD customized goggles. So providers, if you're looking for anything great in terms of having an amazing goggle, get your customized goggle. And Jordan, tell them about recent results that you've been seeing with Halo Profractional. Why do you like this combo?
It gives our patients great results, not an extensive downtime, and it's been a really great combo. We've had patients all day coming in and they ask for this.
Do they have a lot of pain or no?
Nope, not a lot of pain.
And what are their staples in Aftercare? What are they using?
So if they're using their Aerify kit afterwards, we suggest that you pre and post treat your skin with a peel to get the best results.
You can do virtual consultation at cosmetics.com. It's really important afterwards. You always use the anti-age serum and the brightener, as well as the refit face and eye from my skincare line, Emerald Skin.
How often should someone do this?
Well, this is what him and I were just talking about. I want him to do another one in 2 months, maybe a third, depending on how much improvement we get and if he wants to, but otherwise quarterly. For him, it's going to be more anti-aging. His scars aren't too terrible. They're going to improve in 1 or 2 treatments. That bigger scar on his cheek probably needs 2 bigger sessions. And then from there, we do maintenance. Just keep him looking young, fresh, and healthy.
We have some people asking how much, guys. It depends on the combination. The area is treated, also pre and post treatment. We do all of our treatments in combination with other things to get you the best results possible. So just send us a DM, full name, email, phone number. We do virtual consults in office. Guys, we'd love to reach out to you. Do you mentor aspiring dermatologists?
We do. Actually, I have a fellowship. If somebody is a dermatologist and wants to be in a fellowship with me for a year, we could do that. We're looking to recruit more dermatologists for my practices. Aspiring dermatologists, you'd have to, if you're not a dermatologist already, you'd have to pay for training. You can email pj@jasonemermd.com.
If you guys missed that, just send us a DM and we will get you that email.
And if you're a dermatologist already that wants to do a cosmetic fellowship, let me know. We've interviewed a bunch of people. I haven't accepted any as of yet. I want really dedicated people that want to build and really be the best at what they want to do. That's what we do. That's what we are. Right, Rosa? Right, Rosa.
The JEMG Academy is very difficult to get into.
No. It's like, what's that new movie that came out? That London private investigators. Teresa, are you on? Teresa knows every movie. What's the movie of the secret agency from London? You know what I'm talking. What? Kingsman. Good. Kingsman. It's like the Kingsman. Special. Only certain people can be in it. All right, we're almost done. Final passes on this cheek and chin. You guys can see it doesn't look like much is happening, but a lot is going on. We have deep heating of the 1470 nanometer. We have the superficial heating of the 2940. That's why we have all the dots on the surface of the skin. We got a little pinpoint bleeding from the deeper laser. Globally, we're resurfacing, global. But the next step is going to be my favorite step, is switching to our Profractional. We need to, someone's got to open, ask PJ if he can come and open the window. It's so hot in here. I'm going to die. So hot. You're almost done with Halo. You're doing great. You're doing phenomenal.
Look at, see our patient field, so we got thumbs up, thumbs down.
How is it? Thumbs up or thumbs down?
Thumbs
Double
up, guys.
Thumbs up. Double thumbs up.
2 thumbs up.
Good, because you just finished Halo, so perfect. All
You
right,
made it.
Halo is complete. Okay, so next step, you guys, let's take a look. Take a look. We're gonna move this. Just set his eye. You're good. You're good. We're gonna reset this. We are going to take a look at his scar. Everything looks fine. You can see there's some subdermal swelling. You guys can see all the little dots from the Halo. We are now changing the handpiece out to our Profractional laser.
You don't want to miss it. Everyone loves it.
Which we're gonna globally treat. I'm gonna grab a white pencil here while they're changing the adapter. So I'm gonna mark out here a little bit. We're gonna globally treat the area. He's very good. I'm not really concerned with him about pain. Marking out our surface area. Perfect. Really, it only has a few deep scars. So the deep scars we're going to treat more aggressively, and then globally we're going to resurface. So let's set it.
The part you guys can't watch is the settings.
Right, we're there. We're almost there. For those that don't know, Nana or Nana Judy, you need to get it. It's my favorite clothing.
I love the brand.
Isn't it amazing?
Yeah.
I love their sweatpants and sweatshirts. Mm-hmm. Okay, so now, this is what we're gonna do.
Dr. Jason needs to take care of my face. I only trust him. Guys, come see us.
I would love for you to. All right, so here we are. We're gonna go more aggressive now on spot treatments. We got suction over there. Rose is ready. Perfect. Oh, good. All right, here we go. We're gonna do a little more aggressive treatment over the scar.
What is the price of this procedure, guys? That depends on the combination that we're doing. All our treatments are done in combination with others to get the best results. Send us a DM, full name, email, phone number. We'll happily reach out to you.
Okay, so those are done. Now let's find the other spots that we identified here.
Is it not painful afterwards?
No, actually it's not. It's very minimal.
We'll let you know how he feels afterwards, guys. Don't worry, we'll show you.
All right, so we got most of the deep scars, so now
Alright guys, hold on. Now we're going to treat his face globally right now with a different setting, so we're just changing over right now.
So this one's a lot faster, okay, but it's still deep, so he's gonna feel. All right, turn to left. We're gonna do a whole left side now. But it's quick, okay? It's quick. We're gonna get him through it. Just want to give him an overall. Okay, fold. Got it?
Yeah.
Perfect. All right.
Is this laser burning him or is it doing something else?
No, this is burning, guys. It's burning. This is deep resurfacing with our Profractional laser. High density, deep. It's almost like a lawnmower. It's just mowing down thick scars and making his skin just look better. Good. Okay, row 2, done. Hold on. Perfect. is where technique and experience is very important. Understanding how to do this. Also for his skin type.
Is the patient sleeping? No, guys, he's wide awake right now.
He's awake and he's doing phenomenal, actually. I don't know, my patients today are like superheroes. Honestly, right?
Yeah.
Yeah, it's a New York thing. It has to be. It has to be. My LA, I love my LA clients, but they might be a little more babies. They might be a little more babies compared. Okay, we're gonna fill in the blank here. It's gonna finish the upper. We move that?
Yeah.
All right. The thing about erbium, you guys, is it's a cooler laser. It doesn't have as much heat. So let's see. Perfect. Good. All right, so now I'm going to have you take with your right hand. Give me your right hand. Hold right here, just flat.
What's his downtime
okay?
going to be like?
Turn your head all the way. 5 to 7 days of peeling. All right, we're going to finish on the other side. Chin down just a little bit. There you go. All right, here we go. So now we're going to finish on the other side. Here's the thing about erbium. Erbium's a cooler laser. So on darker skin tones, and we just had our patient that came back that Jordan was describing, who's Indian, even in 5 days, 3 to 5 days, her skin was already looking beautiful, light pink, not too bad because we did erbium on her. Erbium, which is the profractional, perfect, is more of a physical than a heating improvement. So we're really drilling holes here in the skin that are going to remodel and make his skin smooth despite his skin tone. Doesn't mean you can do it on every skin tone at a high density like this, but you can do a lot of skin tones. Perfect. These are drilling thousands of little holes in the skin, so obviously you need to know what you're doing to get the best result.
Can you get the same result with Moxie?
You cannot. Moxie is a completely different wavelength, you guys. This is a 2940. Moxie's a 1927. 1927 is more absorbent to upper surface layers. It doesn't go nearly as deep as this is. Then Moxie is going to do sun damage and pores. It's not going to do scars. Remember that.
What type of anesthesia do you use, guys? Our patient's wide awake right now.
Wide awake, but we did injections and pills.
Can you see the results at the end, guys? We'll happily show you when he heals.
And I think he's going to want to take photos and stuff too, so we'll follow it up. It's good to see. It's very good to see. Beautiful.
How does this compare to Fraxel?
It's different. This is an erbium laser. I'm going to take this away. Go ahead and relax your hand. You're good. So I got you guys to take a look right now. Rosa's going to apply, keep your eyes closed. Rosa's going to apply the PRP, which is going to help for healing. And then we basically follow him as he heals. This is going to be, go ahead, Rosa, tell him about the PRP. Oh, wait, we need a microneedling. Let's microneedle. Hold on. All right, so to finish this,
off, guys.
we're gonna put some Hyla B on, which is our Emer skin hyaluronic acid. Just keep your eyes closed. I don't want you to.
What about RF microneedling plus Moxie, guys? That is our Titan Bright.
That's Titan Bright. That's more anti-aging. Now we're gonna put some.
Do you offer the
Can you give me the
fractional? What is
microneedling?
the downtime
Of
of
course.
fractional?
Tell them to DM us because
Guys,
that's.
send us a DM.
We can go
Your
over.
full name, email, and phone
Grab me
number.
the microneedle. So we can go over the reasons why we would choose one over the other. But this is going to be more resurfacing. Remember, the fractional is going to be all non-ablative. This is a combination of ablative and non-ablative. This isn't turning on. Battery?
It was charging the whole time.
It was?
Yeah.
I don't know. Hold on.
As you watch this for, guys, our patient had some scarring on his face. Going to pass some scar revision. I'm going to use some Belfill to plump that up.
And the last part is to put PRP and hyaluronic acid on his skin while he's sitting here like this, because you want these channels to get filled with hydration.
How many days of downtime, guys? 5 to 7 days of peel and reveal.
Exactly. And we want the skin to be hydrated because we really want the skin to plump. We just dehydrated it with the lasers. The lasers work by attracting water and absorbing that water, causing heat, steam heat. And so we need him to cool. So we put a little air in. It's okay, we're gonna wait 1 second. We'll do the microneedle and we'll get me a new charger.
As we're very busy, all of our equipment has been running non-stop all day.
Finished, that was good. You did great.
Do you do incision as well? You call it maybe subcision? Yes, guys, we did some subcision as well.
We just did subcision right here on his scar.
Can people of skin color do this treatment, please, guys? Look what we did this morning.
Yes, we did. Our patient that's very dark skin. It's on our Instagram and our Instagram stories.
We're
he
in New
has
York.
a sensitive skin type as well. He's a darker skin tone. So,
we're in New York. Guys, we're at 30 Central Park
30
South.
Central Park South.
30 Central Park South.
And we had many Indian clients this time as well. So we do every skin tone pretty much.
Doc, why no laser mask?
What?
Laser mask?
I don't
Asking
know.
about a laser mask?
This mask is perfect for anything. It's ND5, so. I've been working 16 years. What happened?
The battery was in it.
Oh. All right, so can you put more PRP? All right, so now we're gonna do the microneedling. So now he's gonna get a little bloody.
A little bloody for you guys.
So this is just gonna make him look a little better. It's also gonna help the skin. It's also gonna make the skin take up the PRP and get a better outcome. I'm going to focus on some of the deeper scars. Watch his ear, Rosa. Just get a little gauze. For the pores. I'm putting on the PRP. This is for
How
healing.
many years do the results last?
Permanent. Results are forever.
Do you subside before microneedling? Does it matter, or have you seen a better result?
We
in
just
a specific sequence.
We already did it, guys. If you want training, pj@jasonemermd.com.
DM us if you guys need training. We like training people.
And yes, we did subcision today. All right, so that is our full acne scar protocol: subcision, Bellafill, Halo, Profractional, PRP microneedling. So make sure you guys use your Emerage Skin. He's going to follow it up with all his skincare products: anti-age serum, refit face, growth factors and peptides, hyaluronic acid, liquor Hyla B, vitamin C, AOXC. EmerageCosmetics.com virtual consult. Stay tuned for more soon, guys, here in New York. Bye. All right, you did good.